We're looking at vaccines in this special issue of Science because there's been a loud, if small, minority of vaccine resistors who've been getting a lot of play lately. And we feel it's really important to look at the facts and the evidence around vaccines and the tremendous public health benefit they've delivered to us throughout the 20th century and that they continue to do. I'm Meredith Wadman. I'm a reporter with Science magazine. One of the common misconceptions around vaccines with hesitant parents is this notion that vaccines given in infancy can overwhelm the baby's immune system or the toddler's immune system. Even if you gave a 1-year-old 11 vaccines in one sitting, that stimulus to that child's immune system would so-called use up only 0.1% of the immune system at that point in time. So we are tremendously evolved to fight foreign invaders, and the number of vaccines is just not consequential in terms of what our immune system's abilities are. When you look at the measles line, what you see there are literally millions of cases in the middle of the 20th century, going down to thousands after the introduction of the measles vaccine in 1963. Measles was no joke. It was no fun for an ordinary kid to have it, but for certain children, measles could kill you. You look now into the late decades of the 20th century and measles is more or less going away. There's a bump in 91 or 2 when there's an outbreak, but then you get in 1998 this since proven fraudulent paper in the Lancet from Andrew Wakefield suggesting that there's a link that MMR, the measles, mumps and rubella vaccine, might cause autism. But that had a really serious impact on vaccination uptake for a number of years. The vaccine court is a court in Washington, D.C., where a petitioner, someone who believes they have been injured by a vaccine, can bring a petition and seek redress in terms of financial compensation for that injury. They look at the evidence and they decide what are bona fide vaccine injuries. By far the most common injury where a needle is mistakenly inserted into the shoulder joint rather than the upper arm and causes a really painful and long-lasting inflammation. The number of claims of shoulder injuries is growing, I believe, for a couple reasons. In 2005, the government added to the list of vaccines against which one can bring a claim at the vaccine court the influenza vaccine. And it so happened that at that time, the CDC also expanded the recommendation for who should be receiving that vaccine. So as a result, in the last decade, you've had more than 1 billion with a B doses of this vaccine shipped. More vaccines, more potential for injury. However, I think one interesting and salient point is that the court has never found that a vaccine caused a child to develop autism. There was a big group claim of more than 5,000 families involved in this in the first decade of this century, and the court just said there's no there. You could come away with a very skewed perception that vaccines are incredibly risky. In fact, it's the other way around. If you are infected with tetanus in this country, the mortality for any given individual is at a risk of actually 13.2% for any given person who contracts tetanus. The risk of getting a really severe allergic reaction that can kill you is somewhere between 1 to 6 in every 1 million doses of tetanus vaccine administered. The risk-reward calculus is pretty obvious, I think. You'd do far better to get your tetanus vaccine.